Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch presented by UMass Memorial Healthcare. Studies suggest that in the U.S., fewer than 70 young athletes die from sudden cardiac death each year. We recently spoke with a pediatric cardiologist about heart disease. Explain the difference between pediatric and adult heart disease.
Pediatric heart disease much more deals with congenital problems. So those are problems that kids are born with. Genetic abnormalities, structural abnormalities where the heart doesn't form particularly well. That's the big difference. And as a result, pediatric heart disease will oftentimes manifest with with much different symptoms as opposed to adult heart disease.
What do the symptoms of heart disease in a child look like?
Exertional symptoms. So symptoms that come about when a child is exercising. Now that actually represents a small population of pediatric patients with heart disease. But that is, I feel, like what a lot of people are worried about the most. The other forms of congenital problems that happen with pediatric patients oftentimes are picked up right after the baby is born.
How important is a defibrillator?
In pediatric heart disease, especially the ones that result in sudden cardiac death of athletes, a defibrillator is one of the only things that has the potential to reverse that problem.
What should parents look out for?
We look for signs of chest pain with exercise, fainting with exercise, unusual shortness of breath or feelings of palpitations with exercise, exercise intolerance.
We've seen stories of children dying unexpectedly from undetected heart conditions. What advice do you have for parents who may be concerned?
And the most important thing is a thorough history and physical exam to look for any symptoms that the patient might have or any family history that might imply that there's some sort of genetic problem that is being passed in that family.